Welcome to the Washington University Endoscopic Non-Surgical Weight Loss Program. Congratulations on taking the next step towards improving your health. In this video, we'll discuss endoscopic, non-surgical weight loss options. These options include intragastric balloon therapy, aspiration therapy, and endoscopic sleeve gastroplasty. In this country, we spend a lot of money on weight loss. We buy gym memberships and diet books and subscribe to commercial weight loss programs. It seems like everyone is always dieting. It hasn't had the impact we'd hoped for, though. Our national obesity rate keeps going up. In the early 1960s, our national obesity rate was just 14%. Today, that number has risen to 39%. But losing weight is difficult, and keeping weight off can be even more challenging. Our bodies are designed to store energy in the form of fat as a survival mechanism. Losing weight is not part of our historical human biology to survive. And it isn't just our bodies making it hard to lose weight and keep it off. It's also the food we eat. Food companies use special combinations of salt, sugar, fat, and crunch to make foods especially appealing and addicting. The right combination of taste and texture tells our brains to keep eating these engineered foods. There are a lot of reasons why it's hard for some people to lose weight. Until recently, bariatric surgery was one of the only medical options to help people lose weight. Bariatric surgery can be very effective, but like weight loss medications, it may not be for everyone. In 2015, the FDA approved intragastric balloons as minimally invasive weight loss devices. Intragastric balloons are placed and removed by an endoscopic procedure and remain in the stomach for 6 months. In our program, endoscopic balloon therapy is part of a 12-month package, which includes monthly, individual, registered dietitian visits and monthly group behavior coaching sessions. Many people ask, is balloon therapy safe? What will I eat? How much does it cost? We will cover these questions. The Orbera balloon is a single balloon device, meaning there is only one balloon placed in your stomach. The balloon is placed during an outpatient upper endoscopy procedure, which takes approximately 15 minutes. The balloon is filled with saline and methylene blue dye so that a leak or rupture can be detected in your urine. The balloon takes up about 1/3 of the space of the stomach and makes you feel fuller sooner when you eat a meal. After 6 months, it's time for the balloon to be removed. The saline is drained and the balloon is removed by endoscopy, similar to the first procedure. Both the placement and removal procedures are non-surgical and require no incisions or permanent changes to the digestive system. The saline-filled balloon has been around for a long time, with over 300,000 balloons placed worldwide in over 80 countries. In clinical trials, patients who used single balloon weight loss therapy lost 3 times the weight of those who used diet and exercise alone. This means patients lost an average of 22 pounds over the 6 months that the balloons were in place. Long-term weight loss requires lifestyle modification. An intragastric balloon, combined with dietary lifestyle coaching, works as a tool to help you achieve your weight loss goal. At your monthly individual registered dietitian meetings, your weight loss team will reinforce portion sizes and help you make long-term lifestyle changes. Without changing your diet and activity level, it will be hard to maintain and continue weight loss after the balloon is taken out. The first week after the endoscopic placement procedure may be challenging, but it's manageable. Side effects of the balloon can include upper abdominal pain, nausea, and sometimes vomiting. These symptoms are most severe in the first few days after balloon placement, but symptoms may last for up to a week. To combat these side effects, we prescribe medications to control pain and nausea while your body gets used to the balloon. You will also be prescribed a proton pump inhibitor for 6 months to reduce your risk of stomach ulcers. In addition to prescriptions to combat side effects, our support team is available to help you every step of the way. After the balloon is placed, you will be on a clear liquid diet for 1 to 3 days, then a modified full liquid diet for 7 to 10 days. You can advance to soft foods and whole foods as you begin to tolerate them, and you will follow calorie target guidelines given to you by your dietitian. Procedures are scheduled on Wednesdays, and we recommend that you take a few days off work and reduce your activity following your balloon placement. While there are no specific restrictions, you should avoid any activity that could result in trauma to your abdomen. With balloon therapy, you'll lose most of your weight in the first 6 months, and healthy lifestyle changes you learn in the program will help you long after the balloon is removed. Data shows that many people's body weight remains lower than it was prior to balloon therapy, even years after the balloon is removed. As mentioned before, the most common side effects after balloon placement are abdominal pain, heartburn, and nausea. More serious complications are rare. The balloon stays in place for 6 months unless early removal is required. Early removal situations include pregnancy, if you need to have surgery, or if the balloon deflates on its own before your scheduled removal. In a study with over 8,000 patients, early removal was required in less than 8% of patients. You are not a candidate for the intragastric balloon if you have had stomach surgery, have a history of small bowel obstruction, take blood thinners, or need to take oral steroids or NSAIDs on a regular basis. Balloon therapy is a safe, effective procedure for weight loss. On average, patients lose 3 times more weight than with diet and exercise alone, and over half keep the weight off long term. Balloon therapy is a great tool for weight loss, and our 12-month program teaches you how to change your behaviors and lifestyle to help you succeed. Another non-surgical weight loss option we offer is called aspiration therapy. After a meal, aspiration therapy works by removing a portion of food from the stomach before it's absorbed into the body. It starts with a simple and reversible procedure where a tube is placed in the stomach that connects to a port on the abdomen. Patients are home within 1 to 2 hours and back to normal activities within days. Here's how aspiration therapy works. After a meal, food travels to the stomach where it is temporarily stored and digestion begins. Aspiration therapy works by removing a portion of the food from the stomach through a tube before it is absorbed. To begin aspiration, the system is removed from its carry bag. The reservoir is filled with normal drinking water, and the lanyard is placed around the neck. The system is connected to a small, discrete button on the skin, which connects to the tube leading to the stomach. When the lever is rotated, stomach contents begin to empty into the toilet. When the flow stops, the clamp is closed and the reservoir is squeezed. This infuses water into the stomach to help loosen food particles. Emptying starts again once the clamp is opened. The process can be repeated until the draining stops and about 1/3 of the food is removed. The rest of the meal is digested normally for gradual, healthy weight loss. In total, the aspiration process takes 5 to 10 minutes. Afterwards, the companion device can be stored back in a small carry bag for your convenience. During the procedure, your doctor will insert an endoscope through your mouth and thread it down your esophagus and into your stomach. A camera attached to the endoscope will produce images of the inside of your stomach, which will be displayed on a video monitor. Next, your doctor will insert a needle through your skin into your stomach at the location where the tube is to be placed. The endoscope will be used to locate the end of the needle inside your stomach and encircle it with a wire snare. Your doctor will then pass a thin wire through this needle into your stomach Grasp the wire with the snare and pull both the endoscope and wire out through your mouth. At this point, there will be a thin wire entering the front of your abdomen into your stomach and continuing upward and out of your mouth. Your doctor will attach the tube to the wire outside of your mouth. By gently tugging on the other end of the wire, he or she will pull the tube back through your mouth and esophagus and into your stomach. Your doctor will continue to pull until the tip of the tube comes through a small 1 centimeter incision. A soft round bumper attached to the portion of the tube that remains inside the stomach helps secure the tube in place. Once your skin is healed around the tube, it will be shortened to the surface of your abdomen. A small, thin skin port about the size of a poker chip is attached to the end of the tube and will sit nearly flush against your skin. The skin port serves as a valve to open and close the tube when you aspirate your stomach contents. Aspiration therapy works when patients eat mindfully, follow guidelines from the dietitian, and chew food extremely well. 1 year of monthly dietitian visits and behavior coaching group sessions are included in the Washington University Aspiration Therapy program. Aspiration therapy has been successful in clinical trials. Participants in a U.S. clinical trial lost an average of 14 to 20% of their total body weight in 1 year. That's 4 times more weight loss than with diet and exercise alone. The most successful patients lost over 100 pounds in the first year. Aspiration helps patients achieve long-term success, as the device can be used as long as needed to meet and maintain goals. Another weight loss option we offer is called endoscopic sleeve gastroplasty. It's a non-invasive endoscopic procedure designed to reduce stomach volume. Sleeve gastroplasty is achieved with one outpatient endoscopic procedure. A suturing device at the end of an endoscope is used to place a set of sutures that get tightened to bring the section of stomach tissue together. The process is repeated several times from the bottom of the stomach to the top until a sleeve is formed. This reduces the stomach from the size of a football to about the size of a banana. The procedure takes about 2 hours and is performed under general anesthesia. Patients go home the same day and can resume normal activities within 1 to 3 days. Like our other endoscopic options, sleeve gastroplasty is completely reversible. After the sleeve gastroplasty, you'll start a liquid diet, which you will continue for at least 2 weeks. Over the course of the next 6 weeks, you'll move to semi-solid foods and then to your regular healthy diet as advised by your dietitian. Like our other weight loss procedures, endoscopic sleeve gastroplasty requires a commitment to a healthy lifestyle. You will have medical checkups and support from your behavior coach, dietitian, and other care team members. Early studies for endoscopic sleeve gastroplasty show successful weight loss. Based on a report of almost 250 patients who had sleeve gastroplasty, less than 1% had serious adverse events. Adverse events include bleeding, an abnormal presence of air or gas in the abdominal cavity, or aspiration, where food, liquids, saliva, or vomit is breathed into the airways. Our patients have lost, on average, 25% of excess body weight 1.5 years post-procedure. You have several endoscopic weight loss options available to you, and today you learned about balloon therapy, aspiration therapy, and sleeve gastroplasty. Weight loss therapy options have benefits and drawbacks, and the amount of weight each person loses will vary with each procedure. All of our endoscopic weight loss options include reversible, low-risk procedures that help patients successfully lose a moderate amount of weight. The cost for each procedure varies, and we do not anticipate that insurance will cover the cost of endoscopic weight loss procedures. However, Washington University offers discounted package prices for the procedures in the program. Package pricing for the Endoscopic Non-Surgical Weight Loss Program includes procedures, dietitian visits, monthly group behavior coaching, and coverage of complications. Package prices do not include prescribed medications, labs, or referrals to other specialists. Package prices are subject to change. Your insurance may cover the cost of your first office visit, so make sure you check with your insurance provider. At your initial office visit, we can answer questions you may have about healthcare lending options in your community. Thank you for taking the time to learn about the Washington University Endoscopic Non-Surgical Weight Loss Program. For more information or to make an appointment, call 314-362-2652.